record. Hello, everybody. Lori Marie from the Mental Health Association of Rhode Island here today. Today we'll have a conversation exploring the connection between mindfulness and mental health. I'm delighted to bring you an enlightening conversation with one of Rhode Island's finest mental health providers. Dr. David Dove is a clinical psychologist in Providence, Rhode Island. Dr. Dove received his PhD in clinical psychology from George Washington University, and he concluded his training at the Alpert Medical School of Brown University. He has clinical expertise in acceptance and commitment therapy, cognitive behavioral therapy, motivational interviewing, adolescent development, and family therapy. Dr. Dove's practice is called Dove Psychology. Welcome, Dr. Dove. Thank you so much for being here today.
Appreciate you having me.
So can you start by telling us what is mindfulness? What does that mean? Can you describe what that means when one is being mindful?
Yes, a simple approach might be to say that mindfulness is paying attention on purpose, with curiosity, without judgment.
Wow, that's a very concise but deep definition. Thank you for that. So mindfulness, it can be part of a meditation practice called mindfulness meditation. And we know that meditation has been a component of certain Eastern religions. Does mindfulness have to be part of a religious type of meditation?
So I just said what mindfulness is. Maybe meditation is a way of slowing down, getting centered, using usually your body and your mind to calm and be still. And then for mindfulness meditation, you're trying to get into the moment, direct your attention. With other types of meditation, it may be that you're focused more on contemplation, or more on reflection. And some of those aspects might be more of what's found in the way meditation is used in some religious practices. It varies across religions, and it's very wide ranging. But for mindfulness meditation, it's not based in any belief system. It's a way of focusing our thoughts or clearing our mind and to get into the moment, and kind of be aware.
Thank you. I asked that question because some years ago, there was some effort to bring mindfulness meditation into public schools, and some of the pushback was that it was believed to be part of a religious practice. And it's unfortunate that this wasn't understood back then.
Right. I would think that today we're much clearer about how to delineate the two and how to talk about mindfulness or mindfulness meditation as a practice. The same way you might talk about yoga as a practice, but not as part of a religion. Yeah.
So if mindfulness meditation is about being present for the here and now, how might that improve or affect our mental health?
So one way of thinking about mindfulness meditation is to think of your kind of the mental goings on, your thoughts, impulses, reflections, memories, as like a crowded, busy community meeting. And there's a place for a speaker, and there's a lot of other folks in the room that may be speaking, whispering, talking, ignoring, etc. So our minds are like that. A lot of times to good effect, sometimes less so, sometimes in ways that are a real problem that really affect our mental health, our state. So mindfulness meditation in one way is about getting the community meeting to quiet for a moment. And that may be through, if there's one microphone, that may be through being really conscious about who is speaking at the mic and what's being said. It may be more of just trying to get total silence, which gives you the opportunity to listen or to really focus sort of everyone's attention on one thing, to kind of bring the meeting to order, the now in the present moment. So I think of it as that way. With mindfulness meditation, in the short term, in the immediate, it has a positive impact on mental health in the sense that it has a positive impact on physical health. Oftentimes you're slowing your breathing, oftentimes you're relaxing your muscles. The sitting still on purpose has an effect. In that practice, in that moment, it's affecting our parasympathetic nervous system, which is the part of our nervous system that's responsible for putting on the brakes or being still or calming down. It's like the parachute. It also affects, some brain studies have shown that it affects our amygdala, our fear center,
Oh,
kind of in the back of our brains, in a positive way that also, I think, lends itself to calming. Think about an anxiety attack or something like that, where part of your brain's telling you that like there's something to fear, there's a threat, there's a, etc. Meditation and some other ways of calming down that amygdala may help to de-escalate ourselves. So that's the immediate impact.
thank you. That's very interesting. So someone like me who has lived with bouts of clinical depression and anxiety every day of my adult life, meditation could be helpful to my mental health because I'm sitting, I'm breathing, I'm in the moment, my body's relaxing, my parasympathetic nervous system is dialing down, and the amygdala part of my brain has been relaxed as well. So I'm no longer in fight or flight response mode. Does that sound right?
Yeah, I think that's a good way of putting what's happening in the immediate moment. We're probably missing some of the mechanisms that are going on, but we can say overall that mindfulness meditation, like a program of mindfulness meditation, has a clinically significant impact on depression, on anxiety, akin to some other ways of treating those mental health problems. So
Thank you.
yes, you're saying it correctly.
And
I feel like there's an. Oh, go
oh, go
ahead.
ahead. I'm sorry, Dr. Duff.
I was thinking that there's another piece that I'm leaving out. Um, so there's strong scientific evidence for positive impact of mindfulness meditation on depression, on anxiety, and on chronic pain. And then there's also evidence being gathered, or mixed evidence, for stress disorders like PTSD, for possible improvement in sleep, some other things like that that are either at the heart of mental health or that are at the heart of like overall health and ways that influence our mental health.
Is meditation contraindicated for any particular type of a mental health condition, or is it good for everyone?
Hmm. I wouldn't say it's good for everyone. My first thought as you say that is like folks who have either physical conditions or the possibility of setting off something physically by doing the things that meditation involves. It can focus on breath and breath work. So maybe something as simple as asthma, but also other types of breathing conditions or health conditions with blood pressure, um, with breathing. Those are the two areas I would think about as far as like to be careful going into this and to really pay attention to how your body's responding. Um, to give more thought to how it might affect certain mental health conditions. The focus really is on getting into the present moment and on quieting and perhaps using that opportunity to focus. So it's good for things like rumination, I believe.
Mhm.
It might be difficult for someone who already has like kind of thought processes that have gone awry in like an acute way. And I think through starting off with a guided meditation, sort of getting into where it's a regular practice, you get to notice some of the things that might be a problem.
Mhm.
With yoga, for instance, we find that for some folks, certain types of flexibility are not there, so you adjust to come up with a way of doing it that's good for your abilities. There may be mental health versions of that as well.
Oh, that's a great metaphor or analogy. Um, do you use mindfulness with your clients?
Yes, um, absolutely. It encourages a way of thinking where I mentioned that community meeting. So let's say that some of those are really important things that members have to say. Others are about something that happened 10 years ago. Others are about like how life might turn out, et cetera. That's a lot to have in one's head at one time, but a lot of us walk around with all that going on, along with grocery lists, et cetera.
Mhm.
One way to reduce like sort of general anxiety is to cultivate the ability to recognize when all that's going on and to not get caught up in what every member is saying all at the same time. For instance, um, if I'm going to the grocery store, I will have like the most productive or relaxing or whatever focused experience if I can let go of the argument I had 20 years ago that I'm ruminating about and take that and apply it as a pattern, and you're able to have a positive effect on anxiety or a positive effect on depression, not by changing the past or changing those issues, but just by recognizing that, oh, there's that thought. I don't I don't have to engage in it. Um, it's also really useful for getting an awareness of your body, as far as changes in breathing, changes in body posture have a positive effect on anxiety or on some of the in the moment depression aspects. We get better and better at noticing those things, noticing muscle tension, for instance, and having an ability to affect a change in it. So those are kind of the key components of how it's used in therapy.
What you said really resonated with me. And that was, if you are mindful of your thoughts and emotions, you sort of get the 35,000-foot view of what's going on in your head. And then you can make sort of a choice to say, I won't ruminate on that argument I had 20 years ago. Because I feel it in my body. My throat is getting tighter. I'm not breathing as deeply. My shoulders are tense. And then you can sort of accept and then let it go.
Yes. And on a day where you can't seem to let it go, there's something to be said about being aware that what's happening for me right now is like my mind is ruminating about this. Um, that's what's going on. It's not necessarily like the end of the world isn't actually happening. My mind is caught up in the idea today, or at this point. Right now, my mind is telling me that the world is ending. That's actually more manageable than the world is ending, whether or not I can sort of stop the thought process, I can have a different relationship with it. So
Thank you. That's great. That's great. If folks at home watching this wanted to get started with a mindfulness practice on their own, how would you recommend one start that?
that's a great question. That's a very good question. And YouTube is probably going to be in the answer somewhere. The challenge is to find things that are useful and really relevant, and that have some of the backing that experience or science would give it. So Google mindfulness meditation. John Kabat-Zinn is one of the folks who created like a mindfulness-based program at Harvard University when he was there. So Googling his name will get you there. Googling that with Harvard will get you some exercises and lots of information about meditation. There are also some different group practices. The Portland Psychology Group Practice has some things online that are mindfulness meditation exercises. So finding a kind of a reliable source, the Mayo Clinic, et cetera, would give you a place to have a good start. Guided meditations are a great place to start. And if you can find something in your community, that's super. Because you have someone who's an expert who's right there, work with you in the moment. And over time, you get to where you can have your own internal process and practice. You can do it on your own. The other way to start is with kind of a micro moment of mindfulness. When you're sitting right now, you can kind of notice how you're sitting, how your body's postured. If you'd like to take a deep breath, you're welcome to do that. Or just notice your breathing. There's some ways of answering the question, what's happening now? They can bring you to a mindful place. What's happening now?
What's happening now? That's great.
Mm-hmm.
Is there anything else that I should have asked, but I didn't? Anything you want to add?
I think we did a good job. I can't think of anything else right now.
Okay. Well, thank you so much, Dr. Dove, for taking the time to speak with us today and to teach us about mindfulness. I hope viewers at home benefited from this conversation. And perhaps you would want to have a therapist like Dr. Dove who could include some mindfulness in your own therapy or counseling. And thank you to the viewers who watched us today as well, and for all your support for the Mental Health Association of Rhode Island. Thank you, everyone, and take care.